I'm Dr. Bobby Byrne, and I'm a neonatologist. Let's talk today about different ways that we can help your baby breathe, called respiratory support, in the neonatal ICU. There are many different ways that we can help your baby breathe in the NICU. This video will review the 4 most common ways that we can help. Some babies need just a little bit of help with their breathing. In that case, we might choose to use a nasal cannula. A nasal cannula is a small, flexible plastic tube that has 2 prongs on the end that fit into your baby's nose. This helps to deliver a small amount of airflow and extra oxygen to your baby to help your baby breathe. Some questions you might want to ask if your baby is on a nasal cannula are, how much oxygen is my baby receiving? And is the oxygen concentration going up or going down? The next level of support we might choose to use in the neonatal ICU is called a heated, humidified, high-flow nasal cannula. The high-flow cannula is similar to the nasal cannula we just described, with the plastic tubing and prongs that fit into your baby's nose. However, with the high-flow cannula, we can deliver higher amounts of airflow, and that air is humidified or has moisture added, as well as oxygen. We use the high-flow nasal cannula in babies who need a little more help than the nasal cannula can provide. Some questions you might want to ask your care team if your baby is on a high-flow nasal cannula are, how much flow is my baby receiving, and how much oxygen is my baby receiving? For babies whose breathing needs even more support, we can use something called CPAP. CPAP stands for Continuous Positive Airway Pressure. Like a nasal cannula and the high-flow cannula, we deliver CPAP through prongs into the nose. But with CPAP, we can deliver higher pressures into the lung to help keep the baby's lungs open. CPAP will be used in babies whose lungs are sicker or who have periods where they forget to breathe, called apnea. It is not uncommon for babies who require CPAP to progress to needing a higher or lower level of support, sometimes within a few hours or days. But CPAP can support your baby for several weeks if needed. CPAP can be used right after a baby's born to assist with breathing, or it can also be used once a baby's lungs have improved enough to take out his or her breathing tube. Questions that you might ask if your baby's on CPAP depend on whether your baby was just born or whether the breathing tube was just taken out. But you'll want to know if CPAP is adequately supporting your baby's breathing. Some babies require a special form of breathing with a breathing tube, often called an ET tube. The ET tube is a small plastic tube that's generally inserted through your baby's mouth and then goes into the trachea or windpipe in the throat. The ET tube is connected to a ventilator, or respirator or breathing machine. The ventilator provides pressure through the ET tube directly into your baby's lungs. We can also provide oxygen and other medications through the endotracheal tube. Because there are many different reasons that babies need breathing tubes and ventilator support, questions will vary depending on the length of time that your baby is on the ventilator. You should not hesitate to ask your baby's care team any questions you have about the ventilator support your baby is receiving. Finally, babies can move between these different levels of respiratory support during their stay in the neonatal ICU, and not all babies will require all the different levels of support that we mentioned in this video. Your ability to care for and hold your baby depends more on your baby's overall medical condition rather than on the type of respiratory support required. The higher the level of support, the more consideration will be made by your baby's care team on the safety of moving your baby in and out of the bed. Discuss with your baby's care team ways that you can partner with them to provide safe care to your baby during any phase of respiratory support.